Have you been taking a blood pressure pill for years without giving it a second thought? If you're over 60, this video could change the way you look at your medication forever. Today we're comparing two of the most commonly prescribed blood pressure medicines, Amlodipine and Metoprolol, and you'll discover why one may be a better fit than the other, depending on your health. More importantly, you'll learn why some older adults suddenly lose their energy, feel dizzy, or struggle with everyday activities without realizing their medication could be playing a role. Stay with me until the end, because I'll also share the questions every senior should ask their doctor before leaving the office. Imagine a man named Robert. He spent most of his life working outdoors and rarely sat still. Even after retirement, he enjoyed morning walks, gardening, and helping his neighbors with small repair jobs. But over the course of several months, everything changed. He started feeling tired before lunch. Climbing stairs became difficult. He stopped accepting invitations from friends because he simply didn't have the energy. His family assumed it was just part of getting older. One afternoon, Robert stood up from his chair and suddenly felt weak and unsteady. He had to grab the kitchen counter to keep from falling. When his daughter checked his pulse, it was much slower than expected. That moment led to an important conversation with his doctor, who reviewed every medication he was taking. The problem wasn't simply his age. His treatment plan needed to be adjusted to better match the way his body had changed over the years. Stories like Robert's remind us of something many people never hear. The body you have after 60 is very different from the body you had decades earlier. Even if you've been taking the same medicine for years, the way your body processes that medicine can gradually change. As we age, our arteries naturally become stiffer. Instead of stretching easily with each heartbeat, they become less flexible. This often causes the top blood pressure number, known as systolic pressure, to rise. At the same time, the liver and kidneys, which help process and remove medications from the body, usually work more slowly than they once did. Medicines may stay in the bloodstream longer, increasing the chance of side effects even when the dose hasn't changed. The nervous system also reacts differently. A sudden drop in blood pressure that a younger adult barely notices can leave an older person feeling dizzy or even cause a fall. These changes don't mean blood pressure medication is unsafe. They simply mean that choosing the right medication becomes more important with age. Let's begin with Amlodipine. Amlodipine belongs to a group of medicines called calcium channel blockers. While the name sounds complicated, its job is actually easy to understand. The muscles in your artery walls need calcium to tighten. Amlodipine limits how much calcium enters those muscle cells, allowing the arteries to relax and widen. When blood has more room to flow, blood pressure naturally comes down. This approach works especially well for many older adults because stiff arteries are often the main reason blood pressure rises later in life. Instead of forcing the heart to work differently, Amlodipine mainly helps the blood vessels become more relaxed. Doctors often consider it one of the first treatment options for uncomplicated high blood pressure in seniors. Research has shown that it effectively lowers systolic blood pressure and helps reduce the risk of stroke when used appropriately. Because older adults process medications differently, doctors usually prefer starting with a lower dose and increasing it only if necessary. Slow adjustments allow the body to adapt while reducing the chance of unwanted side effects. Of course, no medication is perfect. The most common complaint among people taking Amlodipine is swelling in the ankles or feet. This happens because the medicine relaxes arteries more than veins, allowing fluid to collect in the lower legs. While this swelling is often uncomfortable, it doesn't automatically mean the heart or kidneys are failing. Still, it should always be discussed with a healthcare professional, especially if it becomes severe. Now let's look at Metoprolol. Unlike Amlodipine, Metoprolol works mainly on the heart itself. It belongs to a class called beta blockers. These medicines reduce the effects of adrenaline on the heart. As a result, the heart beats more slowly and with less force. For certain people, this can be extremely beneficial. If someone has survived a heart attack, has heart failure, or struggles with certain abnormal heart rhythms, reducing the heart's workload can help protect the heart muscle over time. This is why Metoprolol is much more than simply a blood pressure medicine. In many patients, it serves as an important part of long-term heart protection. However, this same effect can create challenges for some older adults. Because the heart is beating more slowly, some people experience ongoing fatigue. they describe feeling like they have less motivation, less physical strength, and less stamina than before starting the medication. Others notice that their heart rate becomes very low, making them feel lightheaded or weak. People who have asthma or chronic lung disease may also need additional monitoring because some beta blockers can make breathing symptoms worse in certain individuals. One of the most important safety points with metoprolol is that it should never be stopped suddenly unless a physician specifically instructs you to do so. Abruptly stopping a beta blocker may cause a rapid increase in heart rate and blood pressure, which can be dangerous for some patients. Any changes should always be made gradually under medical supervision. Another issue that deserves far more attention is medication interactions. Many adults over 60 take several prescription medicines every day. Some also use vitamins, herbal supplements, and over-the-counter products without realizing they can affect prescription drugs. Amlodipine is processed through pathways in the liver that are shared by many other medications. Certain antibiotics, antifungal drugs, and even grapefruit products can increase the amount of amlodipine in the bloodstream, making side effects such as swelling or dizziness more likely. Metoprolol also interacts with several medications. When combined with other drugs that slow the heart, the overall effect may become stronger than expected. Heart rate can drop lower, fatigue may worsen, and the risk of fainting can increase. This is why medication reviews are so valuable. Looking at each prescription separately isn't enough. Every medication should be viewed as part of one complete treatment plan. Medical guidelines also provide helpful direction. The right choice depends on why you're taking it in the first place and how your body responds. The biggest message from today's discussion is simple. Blood pressure medications save lives every day, but they work best when they are matched to the individual taking them. Age, heart health, kidney function, other medications, and even everyday symptoms all matter. If you've been feeling unusually tired, dizzy, weak, or different from your normal self, don't assume it's simply because you're getting older. Those symptoms deserve a conversation with your healthcare provider. Sometimes the answer isn't stopping a medication. Sometimes it's adjusting the dose, reviewing interactions, or choosing an option that better fits your current health. Finally, remember that this video is for educational purposes only and should never replace medical advice from your own physician. Never start, stop, or change any prescription medication without professional guidance. If you found today's discussion helpful, consider subscribing for more videos that explain common health topics in clear, simple language. And let me know in the comments, are you currently taking amlodipine, metoprolol, or another blood pressure medication, and what has your experience been like? Your story could help someone else ask the right question at exactly the right time.